and welcome. Thank you for joining us today for our facility tour. Just as a heads up, the tour will be recorded. We are here at Front Range Community College, and we're going to be touring their dental assisting facility. I'm here with Karen Ramos, and she's going to tell us a little bit about their program and what we can expect on the tour.
Hi, welcome. I'm Karen Ramos. I'm the program director for the dental assisting program here at the Larimer campus. And Front Range, we have campuses at Westminster, we have Boulder County campus, and also here at Larimer. We have offered a lot of different degree programs, certificate programs, with dental assisting being one of them. Dental assisting is only offered here at the Larimer campus, but it's a great program. Typically, we offer either full-time or part-time for students. So as a full-time student, they can finish in 2 semesters. And then as a part-time student, they can actually finish the program within 4 semesters. As part of their training and education, because we are CODA accredited, the Commission on Dental Accreditation accredits us, and we're one of 3 dental assisting programs here in Colorado that are accredited through CODA. They have to complete 300 hours of externship, so they'll do internships within our clinic and our space where we actually will work on live patients. And then they will go out for the remainder of their 300 hours to meet that requirement for accreditation.
Awesome. Well, we're really excited to see your facility here. Just as a heads up, you guys can type questions in the chat if something pops into mind, and we will answer them as we move along.
Yeah, so welcome. This is basically our reception area. So when we got to design our clinic, we definitely wanted to make it as realistic part of the environment that they would be working in. So we wanted them to be learning in that type of environment. And it had to serve 2 purposes, of course, education, but also we provide limited services to the community as well. So come on in. So we actually have basically 6 treatment rooms here in our facility. We have what we call the panoramic x-ray area, because we, as a requirement, students do learn how to take x-rays, and knowing how to take a panoramic x-ray is one of those. So come on in. Each treatment room is set up the same. And again, students, this is the environment that they're going to be learning in, a lot of their hands-on skills. And then again, like I mentioned, when they get into their clinic courses, they're actually going to be treating patients within this clinic as well. So we have it basically set up like a dental office or a dental clinic like they would be working in. We have our central sterilization area here where the students learn to do infection control, which is a huge part of their jobs as dental assistants. So being able to be proficient with infection control is very, very important. And then within each area, they have the ability to take x-rays, and we actually have one of our x-ray mannequins up over here. The students learn to take on this mannequin first before they're able to then take on an actual live person. This is actually has cadaver teeth in there, so when they do bring up the image, it's going to mimic what they would actually see in a person's mouth. And then from there, we have them interpret their x-rays, determine if it's going to require a retake or not, and then they proceed on. They do earn, in the state of Colorado, we're required to be radiology certified. So we have to show proof of so many hours. So when the students are done, they do get a certificate showing that they have met that state requirement. And in this area here, we actually have what we call a debrief or a consult room. This is oftentimes where we'll debrief with the students once they're done with a lab class. We can go over some additional things maybe that they were having issues or struggling with, that we can put things up on the whiteboard here. We can project things on this monitor here. And then also on this bigger monitor out here, we can also project things as well as they're learning. So if there's a skill or something we want them to see, then we can project it on here, and then they're able to basically mimic that or go out and try to perform that themselves. We actually have a student in here and one of our instructors who is getting her competency completed. So one of the things that they have to do is medical emergency class where they have to learn to take vitals. So they will actually learn to do blood pressures, temperature, pulse, respirations, and how they record that information as well. And we also collaborate with our EMS program, and they do mock medical emergency scenarios where a person will faint or a person will present with some type of a symptom, and our students have to try to determine based on looking at the medical history and the medications the patient's taking, what the potential emergency could be. And then EMS students come in and kind of handle the emergency from that point on. So our students are able to collaborate with them to kind of see what that process is going to look like if they should ever have a medical emergency occur in their office. And we'll oftentimes have the nursing students come in and help our students with blood pressures as they're learning that. So we're definitely very collaborative with other programs here on campus. Our massage therapy program, they've come in and kind of shown our students what they can do as far as stretches and exercises, because in dentistry, it's a lot of sitting, it's a lot of being hunched over. So doing those stretches are going to be super important. So some of our massage therapy students will come and teach our students some ergonomic techniques on how to better have a longevity within their career of dental assisting.
Do students ever get to work on like live people? I know you have the mannequins with cadaver
Yeah,
teeth.
so requirement is they have to expose a full mouth series of x-rays on two live patients. And that's part of their criteria for meeting for their radiology course. And then in their clinic classes, we will bring patients in, or even students from our student population from FRCC, and they can come in and get some fillings done, exam, x-rays, cleaning, all of that can be done here within our clinic. And we do employ actual dentists that are the ones providing the service, and our students are the ones who are assisting the dentist. So prior to them going out on their externship, they're kind of getting that experience here before they're actually going out to an office and being evaluated by that doctor and that staff on their skills. So they have the opportunity to kind of feel that, get comfortable, learn to work with the dentist, learn to work with live patients. And we also do a lot with each other. So they'll be each other's patients for certain things as well. So that, again, that communication piece is going to be super important. So learning how to communicate with patients, with the doctor, co-workers is going to be super important.
Awesome. Any questions in the chat yet?
Nope, not at the moment.
So I heard you talk a little bit before we started the tour about how lots of students are already coming out of the program with jobs. Can you talk a little bit about that?
Yeah, so there right now is a huge shortage since COVID for a lot of the healthcare professions. And dentistry also was impacted during that time, where a lot of people either chose to leave the profession. During that time, dentistry, because we work so close to the mouth, a lot of people didn't feel comfortable in the profession anymore, when in reality, nothing had changed for us in regards to the PPE that we wore, because we always wear masks, we always wear gloves, we always wear gowns. So we were pretty protected even prior to the pandemic. There's a huge shortage right now, so we get a lot of calls from offices, and we have students right now coming from Boulder, from Fort Morgan, because we have kept a lot of our classes more hybrid or online, and they're basically coming to campus for just their labs and their skills. So they have that flexibility to be able to only come to campus 2 to 3 times a week versus every single day. So that provides that flexibility. But yes, then, we can employ them. Again, offices call us from different areas, and it's just kind of how it's been with the shortage, where there's a need for them. And They'll contact us if we have a student who's close to being finished. We'll connect them with that person. And if it's a good fit, then they can either start working while they're in the program or, again, externship that they have to complete. We've been fortunate that a lot of our community dental offices that we contract with throughout northern and a little bit south, even in Denver, have employed our students right off of externship.
What can students expect as like a beginning salary as a dental?
So yeah, so that's actually kind of changed, actually increased since COVID. So starting, they're coming out $18, $19 an hour to start. There's a lot of different benefits that they get, obviously free dental care, typically for themselves and immediate family, usually a healthcare plan, 401k, a uniform allowance. Some offices even do quarterly or annual bonuses. Their continuing education could be paid for. So there are definitely a lot of advantages and benefits to going into this profession. And as a dental assistant, a graduate of the program, you can go and work as an oral surgeon, oral surgery assistant. You can be an ortho assistant. You can work with endodontics, which is root canal. So there's all of the different specialties. Just by going through a basic dental assistant program, you can go and work for, which then can increase the salary that they may go into a specialty because it is so specialized.
With those specialties, do you have to have extra training or no?
No extra training. Again, what they learn here are the basics. They really, their learning really doesn't begin until they're out there working in an office. But as long as they have that basic foundation, they're able to go into and drop into any of those specialties if they'd like.
So students who might be interested in joining your program, what would be their first steps?
Yep, so first steps is to become a student of Front Range. We do not require any prerequisites for our program, so it is a kind of a first come, first serve. So they just basically register, they meet with an advisor, they register for courses, and then they basically start the program. They decide which pathway they want, full-time, part-time. Full-time can be a little intense. It's 22 credits first semester, 23 credits, I believe, second semester. So it is pretty intense. That is broken down as a part-time to 11 to 12 credits per semester over the 4 semesters of the part-time student. It can be a little bit more manageable. I still say as a part-time student in our program, they're still considered a full-time college student because typically 12 credits is what a full-time college student is deemed as.
What would students say, if you typically hear this type of thing, is the hardest part about the program? What's the most challenging thing that you see students facing?
So I would say probably the most challenging is probably trying to navigate some of the online stuff, at least initially, especially if they don't have that experience. I know students now are kind of used to that coming out, but we have a lot of non-traditional students. So we have some single moms. We have students in our program that have been out of school for many, many years. And this is maybe a second career for them, wanting to do something different. So I think would say how they're managing or navigating, and then also how they're organizing their time. So time management, I think, is a huge piece. But like I always tell them, organization, time management, being responsible, those are all attributes needed to be a dental assistant. So they're kind of learning that as they're going through the program, how to manage all of that.
How do the job duties of a dental assistant look different than dental hygienist?
Yeah, so that's a great question because we get that all the time. What's the difference? So a dental hygienist is going to be primarily for prevention care. So they're the ones that are going to be doing and performing the cleanings, whether that's a deep cleaning or a regular cleaning. So when you go to your office every 6 months, that's typically who you're seeing as a hygienist. The dentist may come in on occasion and do an exam just to make sure that there's nothing, no dental issues or complications that are occurring. Dental assisting is kind of the opposite. So basically, like the name implies, we assist the dentist. So we're the ones that are bringing the patient back. We're the ones that are preparing the patient for their treatment. We are the ones sitting side by side with the dentist, suctioning, handing them instruments, handing them materials. We're taking impressions. We're taking x-rays. We're breaking up our rooms, we're cleaning up our rooms, we're preparing for the next patient, we're doing sterilization. So we're kind of the ones that keep the dentist organized. I always say that we are the dentist, extra set of eyes, extra set of hands, and extra set of ears. Because as we're suctioning, our responsibility is not only to make sure we're keeping the area dry and clear for the dentist, making sure the patient isn't drowning, but making sure that the patient isn't uncomfortable, gripping the chair, tears rolling down their face. So we have to kind of be managing and looking at all things as we're doing a procedure.
And I'll kind of go back to the flip side of my previous question. What would be maybe one of the most rewarding things that you hear students talk about in terms of assisting?
Yeah, so it's always fun to see students at the beginning and then at the end, once they're working on patients, and being able to say, wow, I had a hand in, making that patient feel more comfortable when they're coming in and they're hiding, they don't want to smile because they're just so ashamed of their teeth or the condition of their mouth. And then being able to see that transition, I think for them, is when they're able to, that light kind of goes off to say, wow, this is why I'm doing what I'm doing, to help these individuals have a better, outlook on self-confidence and better oral health long-term. So yeah, I would say that that's a rewarding part of being in this field, is helping the patients.
Could we possibly see some of the tools and things that assistants support the dentist with, when they're doing procedures and things like that?
Absolutely. Let me pull out, see if I can find a setup here. And if you can come in here. So obviously hand pieces are important. That's what's going to either remove the decay or prepare the tooth for either a restoration, a crown. Obviously the syringe needs to get the patient numb so that they're a little bit more comfortable. The burrs are the ones that are going to be used in the hand pieces to prepare the teeth or the tooth. Let's see if I can. And of course the various instruments that we're going to use. I can get this removed. No. And of course, there's sections here they're going to use to make sure the patient isn't drowning, and then their air water syringe. So yeah, these are kind of the setup that you can probably expect to see within. And of course, these are just practice instruments for students to practice with on their mannequins over there. But that kind of gives them an idea on putting a setup together, handling the instruments. They are required to, as a competency, pass the instruments back and forth, because there's a certain way that they need to be passed in order that they're being safe. Making sure that they're not, going to harm the patient, it's going to drop or anything like that. And then everything in here is touchless. So water is touchless, right. Hand sanitizer, all of that. So it's, it's definitely, we want it to be as hands-free. And again, we want to make sure their hands are clean at all times. So, yep. So these are the various instruments here that they will utilize. I have up in this other room a chart here of a patient. And this is just a mock patient here. So they have to work within their dental software and be a little bit more proficient and confident in being able to navigate within here. So this is also another aspect. They do a dental office management course. So they learn a little bit about insurances, how that works, so that they can, again, try to explain that to the patients. A lot of what we do is patient education. So we will provide them with, what their treatment's going to be, what that could potentially look like cost-wise, and then kind of map out how we're going to complete that treatment that's going to be more manageable for them. So they have to be very knowledgeable with, everything that has to do with the mouth and the teeth, for sure.
Is there like a universal program that dental offices use in terms of like this right here, what I'm seeing? Are there like separate, are there different options that dental offices use? I'm just curious. Okay.
There's a lot of different types of dental software out there. We have an advisory board and we meet with them twice a year, and we always ask them, what should we be teaching the students? What software should we be using? What new products should we be introducing into for the students? Where are they going to be seeing when they're out there? And we found that Dentrix is one of the more popular types of dental software, but there are other versions or other types out there. What's nice about one is they're pretty similar. So if they go learn this here and then they go to an office that doesn't have this, the learning curve is going to be a lot less because they're pretty similar in how they're set up and they're designed. One of the things, and I can grab that we teach our students in radiology is the handheld, the Nomad. So I can pull one of those out so you can see. So students have to take a separate quiz on that to be for the safety, because they're actually holding it. So I can pull that out. And then when we go into the classroom, we just got a 3D printer. So that's one of the things that offices are now kind of moving toward is 3D printers. So what's nice about this is it's portable. So you're not tied to a wall like you are on those. So this is actually can be used as their patients right here, and they're standing right here and using this. So we teach them, of course, safety when using this. But again, technology and things that they're going to possibly encounter out in the real world, we definitely want to try to introduce them to as much as we possibly can, so that they're coming out proficient and knowing how to use the different types of technology that's out there.
What are offices doing with the 3D printer?
So 3D printers, you can actually do temporary crowns, you can do bleach trays, you can do mouth guards. So everything that you normally would have done sending out to the lab, you can now 3D print. Bridges, partials, dentures, all of those different things. Because they do take a materials class, and part of that is learning how to take impressions, pouring them up. We now have also a scanner that the students can use. Instead of sticking goop in the mouth, they just scan the teeth, and then that can either be sent to the 3D printer to fabricate something, or it can be sent to an actual lab to have whatever it is that they want fabricated. But it eliminates, all the stuff being in the patient's mouth, because, somebody's a gagger, it's going to be very uncomfortable for them. So a lot of technology that's coming out that we're definitely trying to introduce our students to, because they may or may not encounter it, but we want them to be introduced to that. You want to see the classroom, and again, there's going to be students in there, so they might be the materials class, so you can kind of see them in action. And we are actually, Front Range is going to be getting a dental hygiene program. So it's still a couple years away out. There's a lot of things that have to happen and take place prior to that, but that is another option for students. We're going to see how we can crosswalk between dental assisting and dental hygiene. So if you come through our program, we're going to make it a little bit easier to be able to have some of those credits transferred into hygiene and not have to retake some of those courses. And we definitely want it to be very collaborative, so even our students taking certain classes together, that's going to, you know, they're just going strictly into hygiene, or if they're coming through our program and don't want to pursue hygiene, it's still going to, you know, it's still going to fulfill and meet that requirement for dental assisting as well as for dental hygiene. But at some point, if they wanted to pursue dental hygiene, then they can use what they've taken as part of that course for dental hygiene.
Does that seem to be a natural progression for most students, or do you?
It is.
Okay.
You know, show of hands, first day of class, majority of them want to go into dental hygiene, and we'll use dental assisting as kind of a stepping stone. The year prerequisites for dental hygiene. So a lot of them will work as dental assistants by day, go to school at night or online to complete those prerequisite courses. And then they'll, once they apply to the program and are accepted to dental hygiene, then they can kind of pursue that. But again, I always say dental hygienists and dentists they're the best if they've gone through a dental assisting program, because they understand the foundation of dentistry, they understand the mouth, they understand the teeth. So when they're going into those types of programs, they already are going in with an advantage because they have that background and that knowledge versus somebody who's starting fresh with nothing. So we'll watch this way.
When you're ready, make sure you read over the competency so you know what you're supposed to be doing.
You can come on in.
If you haven't done that, take a minute.
That's part of our 3D printer and here set up. We're still in the process of getting all that set up. But our students will be at some point able to utilize this technology. Right now they're learning to do impressions. So they're learning to mix, learning to pour them up. So, and this doubles both as a material space, kind of lab for them, but then also a classroom. So,
You need to stand up for this. You're not going to be sitting chairside when you do this procedure.
I have one more question, kind of back to like that financial piece. Does your program participate in Care Forward Colorado? We do. Okay. Yes. And could you explain a little bit more about that?
yeah, so Care Forward Colorado is a grant through the state that anybody coming through certain healthcare programs, we're one of them. They get basically their tuition, their books, their fees paid for. I don't know a whole lot about it. It's usually handled through our financial aid office. I just know students don't have to pay their tuition, don't have to pay some of their scrubs that they have to get, their books that they have to purchase, any additional things like CPR that they have to have, and also their professional membership, the ADAA that they belong to as students. That's kind of all covered within that Care Forward Colorado.
That's huge for students.
It is,
You know,
absolutely.
Absolutely. I don't think we have any other questions. Do you have any other questions?
If students have questions and they just want to learn a little bit more, who can they reach out to?
Yeah, so they can reach out to me. Again, Karen Ramos. They can find me on the website. Front Range website. They can search dental assisting. On our actual web page, we also have a little bit of information regarding dental hygiene. So if they want to maybe start looking to see what those prerequisites are going to be for dental hygiene, they can jump on there and see what those are going to be. Again, to come into our program, there are no prerequisites. So it's just that they need to apply to the college. They need to meet with an advisor and then just register for courses. We offer a fall and a spring start. So typically most programs are either for just a fall start, but we offer both. And it does require going through the summer, but a lot of those classes, again, like I mentioned, are online or hybrid where they're only on campus so many days a week.
Perfect. Anything else? No. All right. Well, we thank you so much for your time today, Karen, and showing us your facility. Hope you guys learned a lot. Thank you for joining us at Generation Schools Network, and we hope to see you next time. Bye.
Bye-bye.